My name is Amy Goki, and I'm the director of the Friary Pensacola. It's a department within Lakeview Center, and we treat adults with mental health and substance use disorder here. And what I love about my job is seeing people change from the moment that they call us when they're really seeking help to the moment that they decide that they're ready to not see us anymore. I think it's really cool to see people grow and flourish. And we get the opportunity to see people when they're doing their absolute worst, and that they trust us to come see us and know that we can help them just makes me feel really proud. People that would be a good fit for our intensive outpatient substance use program are people that have been trying to quit using substances on their own and they're having trouble doing so and need that supportive clinical team to help them through the process. The process itself takes a little over a month, and so sometimes people do need paperwork in order to get them time off of work so they can focus on recovery. And they do get an individual therapist that they work with and within their treatment team so they can navigate any individual issues that they have while working in a group treatment program. If someone is thinking about seeking services for substance use, there's a couple of things that we would want them to know. Number one, services are available no matter what tax bracket you're in, no matter how much money you have. There's always services available. You just have to know what your resources are. Substance use disorders and mental health disorders fall under the ADA, or Americans with Disabilities Act. If you are working full-time and need time off of work to complete treatment, then your provider can fill out information and paperwork in order for you to take a temporary leave of work for the times you need to complete treatment and work within your treatment team so you can get well. One of the reasons why we would use a medication-assisted treatment for someone with substance use disorder is if they have tried to stop using a substance by themselves and have been unsuccessful. When someone does use substances over time, it does change the brain chemistry, and oftentimes people need a medication in order to stabilize neurochemistry in the brain. It also can reduce cravings in the brain, which will then help with tandem with therapy, will help that person achieve successful recovery. We have a couple of medications that can assist with substance use disorder. The first is Vivitrol. This is a once-a-month injection used for opioid use disorder and alcohol disorder. And you can just call the front desk, make an appointment, see a psychiatric provider, and a nurse can do that injection once a month to make sure that people are successful in recovery. The second medication that we use is Suboxone. Again, that's for opioid use disorder, and that is a once-a-day medication that you would see your provider for once a month and be linked with a therapist to work on behavioral skills to help you achieve your best recovery. We also offer a medication called Spravato, and that's for treatment-resistant depression for people that have attempted a couple of different medications to treat their depression and have been unsuccessful in managing their symptoms. And that's done on an outpatient basis once every 2 weeks, and they can call the clinic and get that set up with to help them achieve better outcomes. If there's anyone that's hesitant about starting on Suboxone or Vivitrol or methadone for opioid use disorder, it's important for them to know that the withdrawal symptoms of opioid use disorder are so intense that the likelihood of them going back to using an opioid or relapsing is pretty significantly high. So we would use a MAT treatment in order to reduce the likelihood of use and reduce the likelihood of withdrawal so that person can be successful in recovery. I think when people seek services and they're thinking, what kind of provider should I have? You want to have someone that you feel understood by. You want to make sure that you're comfortable with the person and that they are qualified and knowledgeable about the issue that you're seeking services with. Another thing that I usually tell people that are seeking services for substance use is know what your support network is around you and what your safety net is in your home environment. If you're going to seek services and try to get well, you want to make sure that your people that you have around you have a buy-in to that wellness. Otherwise, people can really have a lot of motivation and really put in the effort to change, and it's even more difficult because maybe partners or people in the home aren't ready to change either. If you have a loved one that you think has a substance use issue, there's a couple of really important things that you can do to participate in that person getting better. The first is being a really good supportive resource for them, helping them get to appointments, helping them make appointments, really encouraging them to talk about and process the problem. The other is to get support yourself. So we know that addiction and substance use issues are a family disease. We know that the people that are participating in relationships with that person is suffering as well and needs to heal as well. So getting your own help through a support group or through a web-based program or individual counseling is really important so that you can stay healthy for that person as well. If you know someone within the workplace that's struggling with a substance use issue, there's a couple of things that you can do to help that person. The first is to directly talk with them in a non-confrontational and compassionate way. People usually receive that knowing that you want them to be healthy and you want them to be well. If you want, you can talk to that person's loved ones, make sure they're aware there's issues going on within the workplace. And then also if you supervise that person, making sure that they're aware of the resources available to them, such as EAP programs or intermittent workplace accommodations or intermittent leave so they can seek treatment.